What do you think of when you hear the word pneumonia? Do you think of a person lying ill in a hospital bed? Or a person unable to sleep because of high fevers and constant coughing? The truth is, pneumonia is an illness that can affect people in different ways. Pneumonia is an infection that affects the lungs and other parts of the body. When certain bacteria or viruses infect the body, mucus and fluid build up in one or both lungs. This makes it more and more difficult to breathe and maintain a normal blood oxygen level. While anyone can develop pneumonia, some people are more likely to develop this condition, such as those with medical conditions that affect the airways, like asthma, chronic obstructive pulmonary disease, also known as COPD, and cystic fibrosis. Other conditions can increase your risk for pneumonia too, such as those that weaken your immune system, like diabetes, kidney disease, sickle cell disease, and HIV. Other factors that may increase your risk for pneumonia include smoking, traveling to areas with current pneumonia outbreaks, and exposure to certain animals. The symptoms of pneumonia can range from mild or moderate to severe. Pneumonia may cause you or a loved one to experience fever with or without chills, a cough that may or may not bring mucus up from the lungs, shortness of breath or difficulty breathing, chest pain that is worse with coughing or deep breathing, muscle aches, poor appetite, and extreme tiredness or fatigue. A person with pneumonia may also have a fast pulse and may be breathing faster than normal. They may also have a blue tint to their lips and fingertips. This is called cyanosis. Untreated pneumonia can get worse quickly. Serious infections can spread into the bloodstream, causing confusion or disorientation. A body temperature that may actually fall below normal. Breathing that becomes increasingly fast and shallow. And new or worsening cyanosis. If you or a loved one experiences these changes, call 911 or go to your nearest emergency department. To diagnose pneumonia, your healthcare provider will first perform a physical examination, listen carefully to the heart and lungs, and check for other signs of illness. Other tests may be performed to confirm a diagnosis, such as pulse oximetry. This test measures blood oxygen level. Chest X-rays. These can show whether fluid or mucus is building up in the lungs and can help the healthcare team rule out other causes of illness. X-rays can even help the healthcare team determine the type of bacteria or virus causing pneumonia. Blood tests may also be done to help determine the specific bacteria causing the pneumonia. Treatment for pneumonia depends on the severity of a person's illness. Your healthcare team will determine if treatment and recovery can happen at home, or if treatment should occur in the hospital. Antibiotics are used to treat pneumonia caused by bacteria. These may be taken by mouth or given through an IV in the hospital. If a virus causes pneumonia, antibiotics are not necessary. Regardless of the cause of pneumonia, treatment includes getting plenty of rest and staying hydrated by drinking plenty of water and other caffeine-free, non-alcoholic liquids. When your body is well hydrated, it makes it easier to clear mucus from the airways. In some cases, supplemental oxygen may be needed. Often this happens as a part of hospital-based treatment. Additionally, people with very severe pneumonia may be placed on a respirator, also known as a ventilator, to help them breathe. As recovery progresses, respiratory therapy may be used to help clear fluid from the lungs, strengthen chest wall muscles, and maintain the ability to fully expand the lungs. A recovery plan may also include making lifestyle changes, such as eating a healthy diet and quitting smoking. Smoking not only increases a person's risk for developing pneumonia, but it can also make it more difficult to recover from this condition. For smokers who develop pneumonia, quitting is a crucial part of the treatment plan. Pneumonia is not only a treatable condition, it's also a preventable condition. One of the best ways to prevent pneumonia is through immunization. The pneumococcal vaccine helps the body build defenses against a type of bacteria that is a common cause of pneumonia. While this vaccine is safe for most people, you may want to talk to your healthcare provider about whether or not you should be vaccinated. While pneumonia can be a serious illness, It is also a very treatable condition, especially when treatment begins early. By working with your healthcare team to address symptoms quickly, you can often avoid unnecessary complications. Talk with your healthcare provider if you have any questions about recognizing, treating, or preventing pneumonia.